Welcome to Tuesday's edition of COVID-19. Korea's daily tally is holding steady on the 500 level amid the arrival of vaccine shipments. And we have more on inoculation efforts here and elsewhere later on in the program. We start now with the broader pandemic coverage with our Kwon So-ah. So we're marking a third day of cases on the 500 level here in Korea.
Yes, we are, Sunny. So let's get straight to the figures. 516 infections were reported as of 12 a.m., but it is a decline from Monday. And also with that, the number of domestic transmissions has fallen to the high 400s, but with a rise in imported cases. Now, out of an accumulated caseload of almost 137,000, we've also got almost 127,000 who made a full recovery of the virus so far. Now, in the past days, cases have been hovering between the 500s and 600s. So it seems like the graph looks pretty stable here, but there is a growing concern in the increase of person-to-person transmissions, which as of Tuesday stands at 47%, and that is the highest since August last year. And also, those infections are spread to all corners across the country, and we still got triple digits in the capital, Seoul and Gyeonggi-do province, and a mix of single-digit and double-digit figures elsewhere. And let's take a look at the vaccination updates now. We've got more than 71,000 people who received their first shot of COVID-19 vaccination yesterday, and also over 101,000 who got their second shot, with the total now here standing at 1.85 million.
Right, and so as a follow-up to the recent South Korea summit, I understand top officials today, that is earlier on this Tuesday, held a briefing to touch upon the outcomes of the bilateral vaccination accord.
Right, Sunny. Along with the top officials or the top ministers of the Trade and Foreign Ministry, Health Minister Gov'T explained the outcomes of the recent summit at the briefing, and he said that vaccines that the U.S. promised for some 550,000 South Korean soldiers may arrive as early as next week. And also, this is what he said about the Korea-U.S. global vaccine partnership.
By combining the strengths of the two countries, namely the vaccine technology and abundant raw material supply possessed by the U.S. and Korea's biopharmaceutical production capacity, we will work to tackle the issue of global vaccine shortages together.
Now, vaccine supply, especially for the poorest countries around the world, was also addressed by World Health Organization chief at the World Health Assembly, who called on a massive push to vaccinate at least 10% of the population of every country by September, so that at least 30% of the world's population can be vaccinated by the end of this year. And also, the World Health Organization chief mentioned that more cases have been reported this year so far than in the entire year in 2020, and the total number of infections now stands at 167.9 million. Let's also get a closer look at the major outbreaks around the world, with India at close to 27 million. Here, there's been a decline in infections with over 195,000 cases a day, so that number has dropped to below 200,000. Now, meanwhile, over in Japan, or I should say rather the U.S., with just 2 months left until the Tokyo Olympics. In Japan, of course, the U.S. has raised its travel alert to Japan to the highest level, which is a do not travel advisory. Meanwhile, IOC officials as well as Japanese officials are remaining confident that the global sports event can be held despite spiking cases in Japan. And those are the updates I have for now, but I'll see you back after the government briefing. Sunny?
All right, So, thank you for now. Right, it's been about 2 weeks since authorities here pledged broader compensation for those suffering from adverse vaccine reactions, and they've reportedly reviewed hundreds of related cases. For more on this, I have Kim Dami here in the studio with me. Welcome, Dami.
Good afternoon, Sunny.
Right, Dami, let's begin with the government's review of these post-inoculation repercussions.
Sure, Sunny. So the latest government study has revealed that vaccines may have led to some serious side effects in a total of 39 people. The country's vaccine task force said Monday that 37 of them were suspected cases of anaphylaxis. In a total of 13 meetings, local health authorities reviewed around 250 reported cases of serious adverse reactions that have led to critical illnesses or even death. They included 150 with suspected links to anaphylaxis. In the 39 cases where a causal link to the vaccine has been identified, each patient will receive around $9,000 to cover their hospital expenses. And AstraZeneca vaccines were linked to the most number of cases, followed by Pfizer. Side effects were more prevalent in women than men, and also young people, with the most number of cases being reported among those 18 to 29 years old. Vaccines were ruled out as a cause in some cases, with health authorities citing pre-existing health conditions.
We suspect that the likely causes of death in these cases were sudden cardiac arrest, myocardial infarction, brain hemorrhaging, pneumonia, and sepsis.
She also added that a final evaluation is still pending for some of the cases as they await autopsy results.
Right. Meanwhile, Tami, there's been another vote of confidence by authorities here with regard to vaccinations for the elderly.
That's right. So health authorities say even one vaccine dose is effective in stopping new infections and so far 100% effective in preventing deaths among the elderly. So let's take a listen.
There have been no reported deaths among vaccine recipients aged 60 and above. This represents a 100% reduction in the fatality rate as a result of vaccinations.
Also, the vaccines all lower the chance of secondary infections taking place within household settings. So even if you contracted COVID-19 after being vaccinated, you're less likely to transmit the virus to your family members. So this is why the government is urging the elderly to get vaccinated by late June, saying they'll be moved to the back of the line and wait until the fourth quarter if they don't get their shots now.
I see. And as I mentioned earlier at the start of the program, that is, I hear vaccine supplies are rolling in.
That's right. So over 1 million additional AstraZeneca jabs were supplied earlier this morning. So these are the ones that Korea's SK Bioscience is manufacturing in the city of Andong in the southern eastern part of the country. Plus, around 5.6 million AZ shots will be shipped out by the first week of next month. Korean health authorities have secured around 20 million AZ vaccines so far. Additional 55,000 Moderna vaccines are also on the way and will arrive here in the country next Monday. And this is still only a fraction of the 192 million vaccine doses that Korea has secured.
Right, and before you go, Tami, this is something I'm also interested in. I believe there is a more convenient way to sign up for no-show vaccines.
Absolutely. So starting Thursday, people can easily check if there are any no-show vaccines in their vicinity through a local clinic and digital map. So it'll show how many shots are available, which medical centers are offering them, and allows users to book their appointments online. So they can make their reservations through the KCDA website after verifying their identity, and this could help the country further speed up its vaccination drive and to minimize the disposal of unused vaccines.
All right, Tami, as always, thank you very much for the coverage.
My pleasure.
Up next, we are poised to join the regular briefing on the COVID-19 situation here in Korea for this Tuesday. Now, Korea's coronavirus reproduction rate stands at over 1 for the first time in about a month. Accordingly, authorities are urging for public vigilance and for efforts to refrain from activities that may raise chances of transmissions. Also, wearing face masks and ensuring proper ventilation are some of the important prevention measures being advised. Now, we're still waiting for the briefing to start, so let's take this moment to remind ourselves about the possible discomforts after COVID-19 vaccination. Common side effects include pain at the site of injection and fatigue, as well as headaches. Now, with regard to ways to minimize discomfort, here are a few natural remedies. Try applying a cold cloth or pack on the injection site, or try gently moving your vaccinated arm to stimulate blood flow to disperse the local area of inflammation. For those suffering from fatigue, get some rest, and for fever, doctors advise drink plenty of water. If you need to take a painkiller, most doctors recommend Tylenol. The briefing's about to start. We'll come back to you afterwards.
네, 방대본 역학조사 분석 단장입니다. Let us now begin our regular briefing for May 25th and on the COVID-19 infection outbreak here in South Korea. First of all, here are the updates on our status of COVID-19 vaccination. And as of yesterday alone, we have had more than 71,000 people receiving their first dose, and the total now stands at over 3,864,000, which is about 7.5% of the total population. And the second dose recipients now stand at 1,850,000, with more than 101,000 receiving their doses yesterday, and the rate now stands at 3.6%. And as for the senior citizens between the age of 60 and 74, their vaccination booking rate stands at 58.2%. And the vaccination booking rate also for those between the age of 60 to 65 also surpassed 50%. And starting from this Thursday, we will be rolling out our vaccines, AstraZeneca vaccines, especially for those senior age citizens aged between 65 and 74. And also starting from last Saturday, we have been rolling out the Pfizer vaccines to seniors over 75 as well. And as for the seniors over the age of 75, we also have the designated hospitals and the local service centers which are providing the vaccination. So please visit these places if you have already completed the vaccination booking process. And also as for people over the age of 60, please visit the designated hospital or the vaccination center to get your vaccination. And if you do not get your vaccine within June, please note that your turn will arrive only in October or a latter half of this year, which means that it is very important that you get vaccinated now. And also as for those seniors over the age of 60, and if you have any family members who are seniors, please also encourage your parents and your senior family members to get the vaccination booking until June 3rd and also receive their vaccines in the near future. And here are some updates on our supply of vaccine doses. And within the first half of this year, we have about 18.3 million vaccine doses to arrive. And currently, we have about 9.4 million that have already arrived here in Korea. And as for AstraZeneca vaccines, we already also have additional 1,068,000 doses, which has been shipped out today. And also, we will be rolling out these vaccines as scheduled to the public. And after the vaccines, we also have the no-show vaccine updates. And starting from this Thursday, as for the AstraZeneca vaccines, as for the hospitals that have these remaining vaccines, we will be starting the daily reservation process to get these vaccine doses. And you can utilize either Naver or Kakao applications. And up until now, we say that one vial contains enough doses to inoculate about 10 people. And in order to begin to use these shots, we have had the certain minimum number of 7 people that have to be booking and reserved. However, we have eased these restrictions to 5 people. This means that we will be alleviating and reducing some discomfort and inconveniences as for the people who have already booked their vaccination process. And this is also a very similar process as we had the maximum number that is for the public mask sharing program, and we also have utilized the Naver and Kakao applications. And you could also check these maps and to check whether hospitals in the vicinity area have leftover vaccines. We will be providing the information in a transparent manner so that anyone who wish to get the inoculations can get benefits from these remaining vaccines. And next also, we have also the breakthrough cases, which means that the infections, even after the COVID-19 the vaccination, we see that people who have been inoculated for a first and second dose, we see that after 14 days, they develop a very high level of immunity. However, if they get infected by the COVID-19, even after these inoculations, this is referred to as a breakthrough case. This is not uncommon, and please note that these cases exist for all kinds of vaccines. This is because there are also differences in the level of people's immune system. However, most of the people, they have the normal rate of immunity developed after the vaccinations. And as of 20th of May, we have seen anyone after receiving their first and second dose, if they we have about out of the 1.4 million people, we have only about 4 people who have been infected after 14 days of the after receiving their shots. And we see that these cases, most of these cases also have developed or have been infected within the 14-day period before the 14 period days have passed. So we see that the exact correlation with the vaccines are very low as well. And as for those people who have been vaccinated, we see that we can protect or prevent the infections by about 85.9%. And we also have the analysis that these vaccinations can also prevent secondary infections as well. And as we have hundreds of cases, daily cases right now, it is very important to note that vaccination is the most effective and the most clear way to prevent yourself from getting infected of COVID-19. And even looking at the numbers here in Korea and global numbers, we can say that the vaccination is very effective against COVID-19. And as we mentioned, until 3rd of June, we are receiving the booking for the vaccine appointments for the senior citizens aged over the age of 60. So please do utilize this process. And also as for the religious cluster infections, we have seen a slight increase lately. And since March this year, we have had a number of 70 related cases, cluster infections, and this has resulted in the number of 1,700 infections. And most of the cases were related to churches. And in Chungnam, Dangjin, and Daejeon, Daejongbu province, we see that people have been transmitting the virus through small meetings with service members and also through their families as well. And for instance, if we look at the Daegu, Daeseogu district's Islam mosque case, we also see one person who has went to the Ramadan event. This person has spread the virus to other members who were present at that specific event. And taking this opportunity, we will also ask the religious circles to ask all of the people who have clinical symptoms of COVID-19 to get tested. And also we ask you to use and refrain from having group meals or also having small group meetings. And also reduce and minimize the items that are shared by people. And also if you have any clinical symptoms, please do not go to these religious services. And also it is very important that you have ventilation and disinfection of the area as well. And all of the people who are present at these facilities and centers, they need to also wear their face masks and keep 2 meters of distance. And next, we also have some updates on our new variant cases here in South Korea. The health authorities would like to note that we are intensifying and bolstering our quarantine monitoring aspects for the COVID-19 new variants. For the past week, we have had about more than 3 folds of the DNA testings, which hovered around 18% of the cases, which is over the global threshold. And we have seen 277 new variant cases reported. And as for the UK variant, we have seen 243 cases and 14 South African variants and 20 Indian variants. And after October, until now, we see the identified COVID-19 new variants as 1,390, and the UK variant stands at 1,147, and also 150 South African variant, and also 107 Indian variants. For the past week, as for the 277 new cases, we're looking at the routes of infections. Out of the 52, we have 52 imported cases, and also as for the 255 local infections, about 144 were through the cluster infections contact cases, and the rest were identified as individual cases. And the quarantine authorities will also continue to intensify our quarantine and monitoring for these new variants, which are spreading here in South Korea. And we are also intensifying our quarantine measures and monitoring for multi-use facilities as well. In order to return to a healthy community, it is very important that we do so through the vaccination. And as for the senior citizens over the age of 60, they have a more higher fatality rate. However, we believe that vaccinating yourself can also decrease the rates of fatality and also decrease the rates of local transmissions as well. And within your family, if you live with senior citizens, please also enable them to get the vaccination in a timely manner, and also help them monitor their conditions even after they receive the inoculation. And it is very important that we develop our herd immunity through the vaccination. And until then, we need to carry out quarantine measures like wearing face masks and also testing ourselves immediately, and also keeping social distancing as well. These basic protocols are very important. All of the religious circles and need to also meet remotely, not through face-to-face means, and they need to also keep abiding by the basic quarantine rules like face mask wearing and so forth. The quarantine authorities will also like to contain the virus spread here in South Korea. We will be devising more detailed policies so that we do not have any loopholes, and we will also exert our best. Thank you very much.
Right, that was Lee Sang-won with Tuesday's afternoon briefing. So what was the gist of his address today?
Let's start with some messages regarding vaccination. Beginning this Thursday, AstraZeneca vaccination for people aged 65 and above will kick off. So with that, Lee Sang-won, the official, asked for people to get their reservations completed because once June 3rd, after June 3rd, if people fail to make their early booking for the vaccination, they might have to get their shot in the latter half of the year. And he also tried to alleviate concerns regarding so-called breakthrough cases, which means that people who have been vaccinated do contract the COVID-19 virus. But he said out of some 1.48 million people as of May 21st, only 4 such cases were detected. And this is normal also when it comes to other vaccinations for other viruses. And also let me give you an update on the variant cases in the country, which stand at 277 in the past week. And with that, the total number of variant cases is at 1,390. In the past week, we had over 240 from the UK, 14 South African variants, and also 20 from India. And most of those were contracted within the community.
I see. All right. So as always, thank you for that.
Thank you.
It's time now for the second installment of our special week-long series on the 5 arenas for global partnership ahead of the P4G summit here in Korea, starting this coming Sunday to address climate change. In today's segment, we bring you efforts to ensure clean energy over in Kenya.
According to the International Energy Agency, the energy sector alone is responsible for around 2/3 of the world's total greenhouse emissions. This highlights the great importance of cross-border and cross-sector cooperation in energy and the decisive role it could play in helping the world realize its carbon-neutral goals.
기업은 에너지를 생산하고 사용하는 주체이기 때문에 이런 탄소 중립 실현에 대한 과감한 혁신과 전환을 선도해야 합니다. 이번 P4G 정상회의를 통해서 에너지 기업의 혁신과 지속 가능한 성장을 위한 정책 방향, 포용적 녹색 성장을 위한 글로벌 협력 등에 대해서 심층적인 논의가 이루어지길 기대하고 있습니다.
Africa accounts for only a negligible proportion of the world's total carbon emissions, yet the continent has borne the brunt of the climate change impact. As part of its fallout, it is estimated that 1 in 5 children in Africa are taking part in child labor instead of going to school. In Kenya, located in the Horn of Africa, a Korean firm has rolled out an innovative new idea to help the country address its challenges in both education and energy through a single solution. This is SolarCal, a solar charging station. They are placed near schools, and the station charges portable batteries that students can take back to power their homes, incentivizing children to stay in school. The burning sun in Africa is an endless source of abundant energy, and the solution not only seeks to address Kenya's power shortages, but also to present a brighter future for the country's youth through the power of education.
발전소를 지어도 그 외곽은까지 도달하기는 굉장히 어렵거든요. 그리고 또 교육도 학교 지으면 뭐해? 부모님이 일하라고 하면 애들 학교 못 가는 건데 그런 부분들을 많이 생각했었던 게 좀 솔라카우라는 독특한 그런 솔루션으로 탄생한 것 같습니다.
Children could end up skipping school if they're given too much electricity in one go. So the batteries are charged with only enough power to last for one day, to encourage them to come to school every day. One solar cow is only enough to power a small village, but it's been hailed as an innovative and scalable new method of broadening the access to energy in remote areas.
한 번에 124개를 충전할 수 있고요. 오전에 이렇게 한 번, 오후에 또 새로운 거 한 번. 그래서 한 대에 250명이 사용할 수 있는 그 전체 빌리지가 다 쓸 수 있는 그러한 시스템이고요.
In addition to Kenya, the Solar Cow project has also been launched in neighboring Tanzania as well. Although the COVID-19 pandemic has made travel between Korea and Tanzania difficult, the company is providing all the necessary support to ensure that their solution is being put to maximum use.
솔라카우를 통해서 더 많은 아이들이 아동 노동 대신에 그러니까 일터 대신에 학교로 갈 수 있게 되기를 저희는 바라고 있고요. 그리고 학교를 일단 간다는 거는 공부만 배우는 게 아니고 선생님과 그 아이와의 관계, 친구와의 관계 이런 것들이 다 있을 수 있는 건데 이제 그런 것들을 이 아이들도 가지고 자라날 수 있었으면 합니다.
This simple but innovative idea has sparked a revolution in the energy sector. And not only is it helping to fight climate change, but also allowing African children to dream of a better future for themselves and their families.
(60세) 이상 어르신들에 대한 백신 접종 효과를 분석한 결과 1차 예방접종을 한 경우에 감염 예방 효과는 89.5%로 나타났습니다. 또한 가족 내의 2차 전파 예방 효과에 대해서도 분석한 결과 예방 효과가 45.2%로 분석이 되었습니다.
어쨌든 돌파 감염은 대부분 백신에서 다 생길 수 있는 부분이고 앞으로 시간이 경과됨에 따라서 백신 접종자가 늘어나고 접종 이후에 시간이 경과함에 따라서 돌파 감염 사례들은 보고될 예정.
Efforts to contain COVID-19 continue here in the country with current social distancing guidelines in place for over 12 weeks now, which is also roughly the length of time since the start of our inoculation drive. Now, for more on the COVID-19 situation here in this part of the world, I have Professor Chung Gi-seok from Hallym University. It's a pleasure to have you back, Professor Chung.
Good afternoon, Sunny.
And I also have Professor Yu Byung-uk from Soonchuneng University. It's good to see you again, Professor Yu. Professor Chung, the coronavirus reproduction rate, as I mentioned earlier, has risen above 1 here in Korea for the first time in about a month. Do you forecast a fresh rebound in daily cases in the near future?
Yeah, I may say that we could see an increase of confirmed cases, but our reproduction number is only 1.04, which is very low. Anytime we could see less than 1. But if you look at the several factors affecting RO, one of them is the pathogenicity of virus. If you have a weaker virus, then you can see a lesser reproduction number. Or the duration of shedding of the virus from one specific patient. If you shed the virus for a longer time, then you can spread the infection to a larger population. And also the pathogenicity is very important. So, but those factors could be prevented by social distancing or these days by vaccination. So if you have a sudden surge or exponential curve after sooner or later, it could be because of a mass outbreak or because of variant species. But these days, I'll fancy more about the gradual increase of confirmed cases if we persist on this this level of social distancing.
I see. Professor, you do correct me if I'm wrong, but why do our current COVID-19 prevention measures appear relatively ineffective in containing this latest outbreak that began late last year?
Well, we have the very impacted measure, like no more than 5 persons gathering. It was a big impact because we never had like a social distance before, because now our current social distance measure is with even the more than social level 3, it doesn't mention about it. But problem is people are getting tired and getting used to, because nothing changed from the middle of February till now. People are getting used and they are some the trick to gathering more than 5 persons. So you know what? This is current situation. So that's why some part they do struggling to prevent and the block or the transmission of COVID-19, but the other part they enjoy their life even if they feel it's like free from the COVID-19. That's why up and down we are seeing that this number probably end of this current social distance measure probably from the July we're going to have a due. Probably need some change.
Right. And speaking about July, Professor, your authorities have spoken of implementing a new framework of social distancing in July. Tell us a bit about the new guidelines and your thoughts about the implementation.
Well, new guideline. Always the first outbreaking is very important. So they are ready to have the criticize about the new social distance matter, because we are used to very strict quarantine, like the K quarantine is different and very strict. And we are unknown is a very impact word to the people are threatening about COVID-19. But from the July, this world will change because it's more relaxing and we are going to open more. Why? We are having the weapon, vaccination. So I cannot criticize this not yet, but probably the people are going to be shocked. Why? They are more open, social distance, the measure, we're going to have it. But please, our dear audience, don't forget about it. We're going to have a more personal responsibilities. Even the rule is more open, seems to, more relaxing, but personal responsible is more strict.
Right. And Professor Chung, what are your thoughts on the timing of these relaxed new guidelines in July?
I generally agree with the timing because by that time, almost all 60 years old or over could get at least one vaccine at the time. And after getting a first vaccine, if you have passed 2 weeks, then you can have enough immunity at that time. So I think it's a probable time, but these days we can see a lesser agreement to a certain vaccine in 60 years old and older. So if you cannot get at least 70% of elderly people, then you might end up with lesser immunity, herd immunity, I say. Then, as I said before, if you have 25% got vaccinated in the whole population, then you can see a turning point in that society. So if you complete 13 million people by June, end of June, as government suggested, then that is equals to 25% of whole population in this country. Then by mid-July, we can see a certain amount of immunity in our society, and we can also protect elderly people. Because once we have protected elderly people, then we could see a lesser severe cases, lesser mortality, and lesser burden in the medical field.
I see. And staying here in Asia, after months of reporting no new cases or few local cases every day, Singapore is now responding to a resurgence largely centered at Changi Airport, which involves over 100 cases. For more, I have Professor Dale Fisher at the National University of Singapore, who is also the chairman of the WHO's Outbreak Alert and Response Network. Welcome, Professor Fisher.
Thanks for having me.
Professor, let's begin with your thoughts on the rebound in cases here in Asia. What do you believe is to blame for the recent rises, outbreaks that is, in countries like Singapore that had largely kept the virus at bay?
I'd first point out it really depends what you're used to. Obviously, we countries in East Asia have seen quite small numbers for a long time. And when we see that numbers are going up, they're still actually far less than Europe and the US. In Europe, most countries are still having thousands of cases a day and hundreds and deaths that can be measured in the hundreds. And I don't think any of us in East Asia, perhaps Philippines and Indonesia, but most countries aren't really seeing those types of numbers. So what we've seen in Singapore recently is really a peak day of new community cases is around 20 or 30. So it's really a much smaller number, but it does beg the concern. Should we be worried that this will grow into something big, as we've seen in the pandemic through last year? And I'm sure that's also what's concerning people in Taiwan is 300 cases a day going to turn into 500 and 800 like that? So we really do have all the usual non-pharmaceutical interventions to implement. And as well as that, obviously, we've got vaccine, which wasn't around last year. So what the vaccine will do is make a case less significant as it was compared to what it was. Cases used to mean increasing numbers, hospitals getting overwhelmed, and large numbers of people dying. When we get the vaccine, it'll obviously be turned into a much milder disease. And Singapore, of course, has had about 35% of its population vaccinated now.
Right, and staying with vaccination efforts in Singapore, Professor Fisher, the campaign there has been extended to include children aged between 12 and 15, and the dosing interval for the Pfizer vaccine has also been lengthened to between 6 and 8 weeks. What are your thoughts on both measures?
Well, it's about getting as many in the country vaccinated, and obviously children can still get severe disease, especially teenagers. They can still get multi-system inflammatory disorder. So just because they're not as badly off as adults doesn't mean we forget about it. And of course, even though they're less likely to transmit to adults, they still can. So they are very much part of the community. In terms of the other question of increasing the dose interval, this was really to give us a fast forward, if you like. Our capacity is about 40,000 vaccines jabs per day. So if 20,000 of those are second jabs, then you can see if we delay the second dose for 4 weeks, then we can actually accelerate the first dose to 400,000 more people. So this is a strategy that's been taken by many countries, and it's really quite safe. It doesn't impact on the overall efficacy when those people go for their second jabs at 8 weeks instead of 3 or 4.
I see. And finally, Professor Fisher, very briefly speaking, do share with us your thoughts on Korea's inoculation campaign and its efforts to contain the virus.
Well, it's not really for me to say. Obviously, there's a worldwide shortage. Demand obviously outstrips supply. COVAX through WHO and CEPI and Gavi are trying to bring in equity across the world, but obviously we've seen a bit of a competition between countries, and I think if Korea says it can vaccinate 50% of its people by June, then that would be an incredible effort and really help what could be a grim picture if those numbers do keep going up.
Right. All right, Professor Fisher, thank you very much for your thoughts and your time.
My pleasure.
Right then, Professor Chung, what are your thoughts on the regional outbreak that is here in Asia and ways to address it?
Yeah, from the beginning, we could see no vaccine, no treatment at all. At that time, only the social distancing and keeping personal hygiene was the only measure to prevent infection. But these days, we have a vaccine. So in several Asian countries, they were quite successful in preventing virus from coming into their country, and they were quite peacefully for the time being. But the virus can penetrate into a very small hole. Then, however stronger measure you have, you cannot do without any virus for a long time. So they should have imported or planned a vaccination plan in advance. And then they could be more free of a virus in those countries. Same is true in this country. We are still having lots of confirmed cases, but this is a very good time for whole people to get vaccinated. So we need to speed up the vaccination for whole population.
Right, and staying with what Professor Chung has just said, Professor Yu, what do you suppose can Korea perhaps learn from the outbreaks in neighboring countries that have formerly been applauded for their containment efforts?
Well, answer is quite simple. Answer is the vaccination. Why? Because from the beginning, what Professor Chung mentioned about it, no vaccine, no treatment measure, so we do only social distance or blockade of the borderline. It seems to be like working, but now start to open all the borderlines, only vaccination is solutions. And then we do the certain percent of the vaccination we done, but don't believe 100% vaccination. Wow, what a controversy. Doctor, you say vaccine is answer, but don't believe vaccine 100%, because vaccine is answer for first cutting of this wave, but second, to prevent your health in your community is keeping on the social distance measure and personal hygiene together. If we forget about it, it can be rising the number of the confirmed cases again.
Right, so after vaccination, remember to be careful as well then. Professor Chung, local findings reportedly show the vaccine not only protects one from developing COVID-19, but also to a certain extent can prevent transmissions within the household. Could you tell us a bit more about this?
Yeah, that's a very good statistics from our own country. Several weeks ago, we had statistics from England, and they say about the effect within the household in vaccinated or versus unvaccinated member was around 40%. They found 50,000 members out of 25,000 households. So the effect was 40% in England. But in this country, in Korea, they said it's 45%. So when you have an infected person in household, and when you are vaccinated, then you have a chance of 17% of getting infection. And you are not vaccinated, 31% of get vaccinated. So the difference is a result of a 45% prevention rate. That's a good news, but still we need to very cautious. Once you have a family member have an infection, then even though you have a vaccination, then still you have a higher chance of get infection, even though you have a vaccinated. So still you should be very cautious and keep personal hygiene like a coughing manner or washing hands, and sometimes wearing masks wherever it's possible. Yeah.
Right. Professor Yu, today's briefing also touched upon the phenomenon of breakthrough infections, and Korea has recorded 4. Very briefly speaking, what more can you tell us about this phenomenon?
Well, vaccine help, but they're not 100%. For example, medicine for high blood pressure. First target is cut down the number of the blood pressure. But really why we need the medicine? Because that helps the circulation, protect your brain and heart. COVID vaccination, first target is to block to the first penetrating infection. But main goal is help to prevent it to serious cases, complication. So don't be afraid about the break through the cases, because it happens. We have the flu vaccination annually, but influenza is when it happens. But people who got a vaccination, they have been experienced very mildly, and there will happen the serious cases.
I see. All right, Professor Yu, as always, thank you very much for your thoughts. And Professor Chung, thank you very much for your insights today.
Thank you.
Right, pundits have been raising concerns about the lack of public vigilance in recent days amid the prolonged presence of social distancing measures. But do remember, as Professor Yu has said here in the studio, that prevention is better than cure. Thank you for watching.